to GE Healthcare's webinar entitled Artificial Intelligence in Advanced Visualization, Making the Most of AI, hosted by Ant-Mini. My name is Matthias Goyen. I'm a radiologist and GE Healthcare's Chief Medical Officer for Europe, the Middle East, and Africa. In today's environment, healthcare providers face increasing pressure to make more efficient use of IT resources and reduce total cost of ownership to ensure productive imaging and seamless workflows. Healthcare providers also looked to reduce the cost and disruption of maintaining a stable imaging solutions, as well as keep up with new diagnostic reading and workflow technology. One exciting technology, without doubt, is artificial intelligence. AI technologies and methodologies have started to empower almost all aspects of radiology in the past decade, from imaging data acquisition to imaging data interpretation and to clinical decision-making. As clinicians, you may wonder when and where AI is most applicable to your practice, especially when considering which AI tools can support the radiologist's reading workflow and time. We all know very well from a clinician's and especially radiologist's perspective, all these efforts are only accepted if it doesn't get more complicated. The irony is that while technology is designed to help productivity, it can add more work and complexity. So, does AI do its role best when it's invisible, seamlessly integrated into the workflow, or when it's used to supplement existing activities being clearly differentiated from radiologist activities? On the other hand, what do the designers of advanced visualization solutions consider when weighing the benefits of using AI? It is like using a sledgehammer to kill a fly, or is AI probably rather unnecessary? And finally, with a multitude of AI-enabled advanced visualization companies with specific focus areas around, there is now a need for third-party providers to consolidate and curate the AI offerings to understand the depth, impact, and governance of the providers. Ladies and gentlemen, today you will learn what considerations are used to determine where AI is most advantageous in advanced visualization. You will hear what is paramount when considering whether a post-processing solution has AI or not, and if it even matters when considering solutions. And finally, what are the key factors used to determine which companies are considered from a third-party provider? It is now a great pleasure for me to introduce our panel for today. Professor Alain Luciani, full professor of radiology from Henri Mondor University Hospital in France. Dr. Kai Villanova, associate professor of radiology, director of Magnetic Resonance Institute, Clínica Girona in Girona, Spain. And Dr. Office Kolokithas, Associate Professor of Radiology at the Department of Radiology, Section Abdominal Imaging at the University of Washington, Seattle in the US. And we have two colleagues from GE joining today, Nicolas Gaugin, Senior Manager, Deep Learning and Image Analytics from GE Healthcare. And last but not least, my dear colleague and friend, Jan Beger, Senior Director, Digital Ecosystem, Europe, Middle East, Africa at GE Healthcare. By the way, ladies and gentlemen, we are broadcasting live. This is an interactive discussion, hopefully, with our panelists. So please ask your questions in the Q&A box and hear directly from the experts. Thank you very much. And now I would like to ask Nicolas to kind of kick it off and give a short overview of the topic we'll be discussing today. Nicolas, the screen is yours.
Thank you, Matthias. Good morning, everybody. Good afternoon. So artificial intelligence is a broad term that includes many different technologies. In the field of medical imaging, it typically refers to the use of machine learning or deep learning to automatically process and analyze medical image data. There are now lots of publication, data challenges in AI or benchmarks that establish deep learning as the state-of-the-art technique for all kinds of image processing tasks, such as segmentation, anatomy detection, recognition, pathology detection, noise reduction for all kind of imaging modalities such as CT, MRI, ultrasound, X-ray. So here you see a typical example of a deep learning model that is called UNet, very popular in image segmentation. Next slide. So this comes in, in a context where the number of images, of medical images, is increasing constantly. The acquisition systems is also improving. And interestingly, AI may contribute to this when it is, for example, used to improve the image quality and therefore enabling faster acquisition processes, where we think, for instance, in fast MRI protocols or low dose acquisitions. So more images are generated each day, and that's more images to review by radiologists. And that's where AI and deep learning comes as a useful tool to review all those images. Next slide. So in this slide, there's a number of examples of use cases in advanced visualization. At the top, you see an example of liver segmentation in CT. And that is to illustrate how AI improves over traditional image processing. That's an example, but that's also valid on many other use cases. What we see is that with deep learning, with AI, we are able to do this kind of segmentation task very efficiently with up to 95% of success rate. That means for the end user, less time to review and edit the outcome. And he has more time for the rest of the workflow. Other example at the bottom, you see on the left CT spine labeling that can be done with AI in a matter of a few seconds. And on the right, an example of prostate segmentation, where AI can be used to automatically estimate the volume of the prostate in MRI, which is very useful in the context of prostate cancer. And in the middle, another example of segmentation showing how segmentation can help in the visualization of complex structures. And in this example, carotids on a CT exams that can be visualized in 3D. And you can see also the anatomy surrounding the carotids. So yeah, lots of application, lots of use cases, and more to come in the field of lesion scoring, lesion detection and characterization, image segmentation, as shown here. So that's it for the quick intro, Matthias.
Thank you very much, Nicolas, for this quick overview. Let me quickly ask you, what would you say, what are the top 3 criteria that you use to determine when advanced visualization is best suited for AI algorithms?
So we, of course, work very closely with radiologists to determine when AI is meaningful in a clinical workflow. And there are a number of criteria indeed. The first one, I would say, and it's valid not only for AI, but for, let's say, clinical workflow in general, we try to determine whether AI is useful in terms of clinical accuracy. Does it make the workflow more accurate clinically? That's one important point. More accurate and more reproducible. We try to build tools that make the workflow more reproducible. Like if 2 clinicians review the same images, we want them to do the same diagnosis, to do the same measurements, same quantification. And I think with AI, that's a powerful tool to enable this kind of reproducibility aspect and accuracy aspects. The second thing, of course, is also reproducibility. The second thing is productivity. Productivity. We want to improve the productivity. You have seen that there are more and more images to review each day. And so we need those tools for the radiologists to not spend too much time reviewing each individual pixel, but, let's say, doing the review more effectively. So in the end, saving time for the radiologists. So that's, of course, very important. So accuracy, reproducibility, and of course, efficiency, saving time. Last but not least, I mean, more from our perspective, I would say, we also keep an eye on the development cost. There are different types of, AI algorithms. We have deep learning, but we have also other types of machine learning-based algorithms. And all of those have different development costs. So we also consider that when building AI solutions. We want, of course, like the deep learning technology really requires a lot of effort in terms of collecting data. It's not only a question of quantity of data, but quality of data, making sure that it is diversified, that it is collected from different countries, that it is representative of different clinical practices. So there are a lot of costs related to that. And maybe in a number of cases, you don't need a very complex deep learning model to do the task, but maybe some simpler machine learning model or conventional image processing. So we consider all these to decide whether we want to build an AI solution.
Thank you very much, Nicola. Now I'm looking at the clinicians here on the panel, Alain, Kai, Orphis. What factors do you consider AI worthwhile in post-processing, and would it influence whether you would consider a particular application versus another? Who would like to go first? Orphis?
Sure. I think the most important factor for us in the clinical field on a daily basis is increasing efficiency and accuracy. One does not go without the other. You can spend an hour on a workstation and craft beautiful results, but if it's an hour, that leaves you with an hour behind in your workflow. On the other hand side, you produce nice images, but like we had it recently, the surgeons come back to us and said, hey, you got a 16% discrepancy to what we got in the OR. So what's going on with your tool? So these two things I think are the most important ones, accuracy and efficiency.
Great, thanks a lot, Orphis. Kai, Alain?
Well, yes, of course. I agree also with Orphis with it's very important accuracy and efficiency, but also one of the aspects that it's very important is the implementation in the own system and to the optimization on the reporting. So I think these are tools that should be considered when one is considering these advanced visualization, but the next step of information in our reporting, because otherwise then we are going to lose time what we have gained before in our analysis if then we have to spend more time in incorporating in the report. So I think this is another important issue of incorporating this advanced visualization into the reporting system. So this is a key factor also.
Yeah, that's a great point, Kai. I fully agree. And I looked at Alain nodding. So please, your comment on this.
Yes, Matthias, of course. I think those two words to make it short, it's relevance of the software. Does it really target something that we want to focus on? And then integration in the workflow, because the difficulty is having narrow answers to multiple questions. I mean, we have to have something which is fully integrated in our workflow. If not, even if the software is relevant, even if it addresses a question, there will be difficulties in integrating it and using it. And this is what we want. We want to have productivity, as Orpheus said. And for that, we have to integrate the software in our workflow.
Thanks a lot, Alain. Now let me include Jan. Jan, when we work with third parties that offer AI solutions in advanced visualization, what criteria and partners do we consider when making such evaluations? Maybe you also use the opportunity to introduce again what exciting stuff you are doing with regard to the Edison Accelerator.
Thank you, Matthias. Thanks for the question. I think it's an important one. Look, when we think about AI in advanced visualization or in imaging in general, this is such a vibrant, such an interesting and agile space right now, where we see constant progress. But it's also important to highlight that it's still very early in the commercial adoption of AI systems in healthcare due to multiple barriers. And we at G Healthcare, we are accelerating the transformation of healthcare and the adoption of AI technologies, but we can't do this alone. We strongly believe in the power of a collaborative ecosystem to foster open innovation and the digital transformation of healthcare. And look, the speakers already said it. There are so many AI use cases for such a broad range of imaging modalities, anatomies, and clinical findings. At GE, we are not just focusing on our AI. We are very interested for third parties to come in and collaborate with us so that the end user has the benefit of a broad range of algorithms and not just GEs that lead to more efficiency, productivity, better quality, and ultimately better patient outcomes. And third parties to work with are evaluated according to their solution offering, the importance of use cases the solution is built for, the status of regulatory clearance, their commercial availability and traction, of course, as well, and things like compatibility. Yeah, for example, that was mentioned earlier as well, we are very interested to seamlessly integrate clinical applications into the radiologist reading or reporting workflow. And then there are other things. We are also interested in their scientific approach, quality of data. Nicola mentioned this, their model training approach and statistical methods and so on. So companies out there in the imaging and advanced visualization space that have market-ready AI products can reach out to us through our Edison Developer Program. We have the tools to speed deployment and commercialization.
Thanks a lot, Jan. I think this is really exciting what we are doing here and trying to onboard startups and bring them together with clinicians who really know how to solve the pain points and really know what the pain points are. Alain, maybe you share with the audience, some work you do on a daily basis, and maybe you can tell us, where do you see applications of AI, especially in your practice?
Yes, Matthias. So, of course, we're only talking about advanced visualization. So that's AI software with perception and reasoning. I'm not talking about reconstructing images with AI, but focusing on the advanced visualization. I'm working on liver tumors and liver oncology. And for liver tumors, one of the key aspects of AI is whether we can have a clear target, whether we can trust the software, and whether there's a clinical benefit. And what we developed is a AI collaboration, collaboration around AI software dealing with the characterization and categorization of liver tumors and primary liver tumors, because that's a clear target. And you mentioned at the beginning that we have to make sure that AI can also help us to have better reproducibility. And sticking to guidelines, sticking to internationally recognized guidelines is very important. So we focus on LIRADS, seeing whether AI could help in categorizing lesions with primary liver tumors using LIRADS. So this is a clear target. Then we have to focus on trust. Can we trust the software? Because of course we are accountable of what we use. So the way that we can explain the software, whether we can explain with what population it has been trained and how it has been trained, how the performance has been evaluated, is one of clear aspect where that was very important in our clinical practice. So focusing on the clinical question that's relevant, having a clear explanation is, I think, very important so that we can have a good software using AI that we can explain to the patient, because that's also a question that we have to answer, to being able to be responsible for what we use to the patient.
Thanks a lot, Alain. Ladies and gentlemen, as we are broadcasting live, please ask your questions in the Q&A tool, and I'm happy to direct them here to our panelists. Kai, where do you see AI supporting your workflows in your daily practice? Can you share some examples?
Yes, well, indeed, it's my field of important is prostate. So in this case, as probably you all know, it is quite recently that there is clear the standard of care to diagnose prostate cancer nowadays is prostate MRI. So the diagnosis of prostate cancer is MRI. So there is a huge demanding nowadays of prostate MRI. So as Nicolas has said, we have an increased amount of images to analyze. And already Nicolas has shown one of the application that there is a huge need to us to have tools, advanced tools, to support us, to analyze, to segment, because in every prostate MRI study, we should provide the volume of the prostate, the volume of the lesion, which is going to be very important, and all these features, we need accurate tools, and this is what AI has to provide. And also, the detection of the lesion. And this is very important, because prostate MRI is the key tool to detect the prostate cancer nowadays. So every prostate cancer depends on MRI. So how important is we have these tools in order to provide the best accurate detection of prostate cancer? So there is a huge importance to have these tools nowadays for radiologists in order to provide for our patients the best accurate tools. So there is no other place for prostate cancer, prostate MRI, to provide these advanced tools to improve this outcome for the diagnosis of prostate cancer. So this is a great field to incorporate these tools, yes.
Kai, quite frankly, I'm so glad that you advocate for bringing MR early into the prostate cancer pathway, because it used to be like urologist would do a 12 per needle blinded biopsy. And first of all, you couldn't be sure if you catch part of the tumor. And second, if you caught part of the tumor, you were never sure if you caught the most aggressive part of a potentially heterogeneous tumor, right? As we know, prostate cancer is. So being an MR radiologist myself, I of course love it, right? First do the non-invasive multi-parametric MR, and then based on the results, do an MR transfusion guided biopsy, right? For example.
Yeah.
No, this is really great to hear. Orfis, and how does the solution, the AI solution, account for clinical accountability, or is it implemented as a tool to kind of assist the clinical professional rather than a replacement?
Well, our most important mission in our job is to improve the care of patients. So ultimately, we are the ones, we the radiologists are the ones in our field who are accountable and responsible for the outcomes. Now, you can add AI to make us more confident in our workflow. If we are experts in the field, be it now a liver expert or prostate expert or whatever, we're probably going to need a little bit less help than somebody who is a traditional radiologist user who covers all the fields in radiology. So I think it's a very important distinction to titrate and customize the use of AI to the user as well. So the user can either use it just to improve herself or himself, make him or herself a little more efficient, but accuracy is top. So if you have another user who is less savvy on a certain field, then AI can have a bigger impact. But at the end, it's always the radiologist who is accountable for the end result and has to stand up and basically sign a report with his or her name. The end user, which is like the patient, the clinician, doesn't care if it's AI supported or not. What they want to have is an accurate report and clinical accuracy.
So Orfis, if I get it correctly, you advocate for like a hybrid model, 1 + 1 is more than 2. I mean, it's the radiologist and the work is augmented by use of AI and advanced visualization, right? And no one wants to replace the radiologist.
Yes, you know, the famous saying is AI will not replace radiologists, but radiologists who use AI will replace the radiologists who don't use AI, right? That's a famous saying. So I think if AI offers help, but doesn't impose it on yourself, but also doesn't take accountability, I think this is probably the right golden pathway in the middle that everybody has to choose for himself or herself.
Right. Alain, Kai, anything to add on this philosophy or approach?
Well, this is something that I think it's very important, because AI is not going to replace us, but it's the mandatory tool in order to help in our decisions. And this is very, very important, because as I'm talking on my field in prostate MRI, it is imperative to have these tools in our analysis with such a huge amount of information on T2, diffusion, ADC, and dynamic contrast. All these images have to be integrated. If we have a tool that we have a kind of filter, it detects the lesion. Of course, this is going to have a visible analysis as a radiologist to have our final decision. But the previous decision should have performed with this artificial intelligence. And this is something that is a clear need. If we want that our images have to be really improved to the outcome in this field that I'm talking about, prostate cancer diagnosis. So artificial intelligence is not to replace, it's going to be an important supportive tool. And this is the big issue that we have to take and we have to incorporate thanks to the companies that are being applied. So this is the main field that I have to provide on these advanced tools, yes.
Right. So obviously all of you are kind of embracing AI and advanced visualization. But I mean, I'm sure you've been on panels where people are afraid also, right? What will happen to me? An AI application works 24/7, never gets tired, always performs the way it, it is built. And so just out of curiosity, in your departments, is everyone like an ambassador of these new techniques? Or, I mean, how do you deal with that? It's a process, I guess.
Matthias, if I can kick in. Yes, of course, we are all fond of technology innovation, and that's the way radiology has been developed for centuries. So this is not new. We are fond of this technology, but we are clinicians making sure that the patient has the correct care. And I think the key word with that is education and training. We have to train junior radiologists to understand AI, to know the limits of AI, to be questionable on what is a good software, whether it has a good target, a good relevance, whether it has been greatly performed. And this is a key issue, I think, for the future of radiology and for the future of the integration of AI. We have to be very sure that what we use is clearly relevant to the patient. And that goes to education and training. And I totally agree, if we do not train our residents who are tomorrow's radiologists, we will lose contact with what you say, that is being in control of the AI and using it in the correct way.
So on the one hand, this has to get into the curricula, right? On the other hand, we have to ensure, I guess, that a resident is still able to analyze an X-ray of the chest. You know what I mean? Because if there are algorithms that triage the normals away, because this is the dream of the radiologist, don't show me the normals. So it's a challenge, right?
Absolutely. It's a challenge. It's integrated in a lot of training curriculum now. And I'm sure the residents know what they have to do with that, definitely.
Right. So Nicola, I have a question for you. How do you introduce your AI solutions to hospital-based clinical workflow? How formal or informal is it?
So first, of course, we have lots of products in advanced visualization in the AW products that have been developed, before the AI era, let's say, with conventional image processing. So we first want to modernize those applications and introduce, as I said, AI when this is meaningful. So that's one thing. I mean, we clearly want to improve the existing application. We want to integrate AI seamlessly in existing workflows. As it was said previously, I mean, we really don't want to change completely the workflow. That's more an iterative effort. And then in terms of introduction, formal or informal introduction, I think there is a very strict process of introducing a new technology in our devices, especially when we include AI. We really have to submit to the regulatory authorities a complete description of how the model was evaluated, was trained. Professor Luciani mentioned the importance of these aspects. How do we train the models? How do we collect the data? How do we test the algorithm? How diversified is the evaluation data? Making sure that it covers all the, let's say, use cases or the intended use of the medical device. That's something that is very important. So that's the main part, I would say. We have those two sets of exams, training, testing, making sure that we have those two sets that are independent. We evaluate on the test set. And there are lots of other good practices when we want to build an AI solutions. Lots of publication actually that describe how this should be done. And we submit that to the regulatory authority and they approve. And then we have a cleared medical device that can be commercialized.
Right. Thanks a lot, Nicola. I have another great question from the audience, and this one goes to Jan. What is something you would tell a third party coming into the advanced visualization space, right, to consider when looking to enter? Any tips and tricks?
Oh, thanks, Matthias. I think there are a lot actually. Right. First of all, I would say, and that's quite often actually underestimated. Incorporating AI technology into a field as closely regulated and complex as healthcare is a real challenge. And there are basic logistical concerns as well as more, let's say, complicated barriers to adoption that need to be addressed. And despite the fact that healthcare is a high interest industry for AI investment, AI products in the space require much more careful design and testing than those in other industries. And really, companies innovating with AI in healthcare, they need to be prepared to invest the time, the effort, and expertise to create products that focus on the needs of providers and patients. And I also would say, unlike previous technology booms in healthcare, here and now, close collaboration with healthcare providers is really foundational from my perspective for successful AI adoption in our space. So look, when entering the space, the first thing I would highlight is make sure you work on, validated problem statements of importance for healthcare providers, right? We don't need another lung nodule detection algorithm. We just need better ones. And don't develop a deep learning solution because of the technology. Start with the problem. And then there are things like make sure your team of developers and data scientists has access to healthcare professionals, because those groups should not underestimate the clinical domain knowledge required to build an AI product that will be trusted, accepted, and adopted. And then start building with having IT interoperability in mind, right? Because as we said earlier, the AI system needs to be integrated into existing digital workflows. And then I would say be laser focused on the scientific approach, on data quality, on the model training approach, statistical methods, and of course, prospective studies. You need to demonstrate efficacy in the real world. And then also early start thinking about how you can demonstrate cost savings and improvement in care quality.
So Jan, I heard about the importance of clinical knowledge on the side of the startups, because ideally they solve real pain points. Is this something in your discussion with startups where there is room for improvement? Let's say it nicely. That probably startups lack the clinical expertise, so they probably solve problems that are no problems.
No, I mean, look, it depends on those groups, right? And how the team of founders is is set up, right? We often see startup companies where radiologists, clinicians are on board, and this is, I think, perfect. But you need a good mixture of domain knowledge, right? You need strong data scientists, you need great software engineers, you need this clinical know-how. So. And what we see quite often is that, especially when those ambitious technology groups start working in the healthcare space, they are quite often lacking access to clinical domain knowledge, lacking access to healthcare professionals. And this is what we can help those groups with in our startup acceleration programs.
Thank you very much. I see another question from the audience that I would like to direct to our clinicians here on the panel. I mean, we know that ideally AI solutions, empower you to make a more accurate, a faster, a better diagnosis. So have you noticed that AI is a real benefit on your workload or in the quality of your work? Do you have a before-after example? That is the question. Alain, would you like to start?
Yeah, the answer is yes. I will try to be as specific as possible. First application is a conventional X-ray, especially bone X-ray and chest X-ray from the emergency departments. And the idea is not to change and not to use exactly the whole accuracy of the AI software, but to make a prioritization of when we make the report. And the prioritization is when the software is just hesitant. Why? Because that's where the radiologist can pop in very rapidly and solve an emergency problem for the patient who is at the emergency department. So clearly there's a benefit in the way we manage patients. And the second aspect is dealing with the software that we have developed with LIRADS, and the keyword is standardization. We are a large department with many different radiologists with different experience in liver imaging, and using AI software standardizes the approach. That is, it made us easily implement LIRADS for the whole colleagues. And I think that's a clear benefit that all patients, potential HCC, have a LIRADS assessment, and that was helped by AI. And the second thing is, again, with junior radiologists being able to use LIRADS more easily. That's a clear benefit that we saw.
Thank you very much, Alain. Orphis, any examples from your clinical practice?
Yes, it goes a little bit off the track from advanced visualization into the clinical arena for detection and detectability. We had great success and good experience with software packages that would allow us to prematurely identify urgent findings on the work list, such as pulmonary embolism or cerebral hemorrhage. Basically, you can have an AI tool highlighting on the work list before the radiologist opens up the case if there is an urgent finding like the two examples I mentioned or not. Of course, it needs to be integrated in the correct clinical arena. If you are a tumor center that does, let's say, brain surgery every day, then you have AI tools probably muddying the water a little bit, and you're going to have all these flags coming up when you have a post-procedure hemorrhage or a follow-up of a hemorrhage, or if somebody has a follow-up of pulmonary embolism, then you're kind of adding a lot of noise. Basically, you want to know which one are the real urgent ones or not. But in an ER environment, for example, it could be very useful to have premature diagnosis popping out on your screen before you as a radiologist get to that.
Right. Thanks. Kai, any examples from your daily practice?
Yes, very, very, very easy. And as we have said, this is because we have a clear guidelines of prostate MRI diagnosis, that is PIRATS. So PIRATS was developed in order to provide less variability in the evaluation of prostate MRI. So there is a clear variability whether we measure, whether we evaluate the measurement of the prostate volume or the prostate lesion. And as we have seen in this presentation of Nicolas, if we have a tool that, of course, is going to provide less variability in the volume of the prostate, in the volume of the lesion, we are going, and this is what we are starting to apply, to provide less variability in our detection, in our measurement, in all the different data that we have to provide in our final report in a PIRATS analysis of a prostate cancer detection. All these tools, what is going to provide faster, more accurate, and of course, better diagnosis for our patients. So this is the daily practice that we are incorporating in order to improve all this workflow for our reports in prostate MRI. So a clear benefit in this clear everyday practice, yes, in prostate MRI.
Thank you very much, Alain. I was thinking when you talked about bone X-ray, and high volume, and we have a mobile X-ray system with built-in AI that is able to detect a collapsed lung. And I mean, it's not whether the radiologist still outperforms the algorithm or vice versa. It's just about prioritizing critical images when it's 3 o'clock in the morning and the tech is doing the X-ray on the ICU, we know that it takes up to 8 hours till a radiologist sees that that X-ray of the lung. And I mean, we know with pneumothorax, this might be too late because it's potentially deadly, right? So we have to really look at images first. And so now here we have a tool where the tech sees, oh, it's very likely this patient has a pneumothorax and can send that image to the PACS with high urgency or call the radiologist to please take a look at that image first. I mean, it's not about putting the radiologist out of business, but just highlighting critical cases. I'm just seeing another question maybe for Nicola and Jan. And you mentioned high quality representative data. Do you see an industry effort to create such high quality and representative data sets from different locations to be available to startups for research?
Yeah, if I may, Nicola, I quickly get started, and please add what you have to say. Look, we see a lot of different data sets being available, right, and more of them are coming out and are available for builders and ISVs and developers. But again, right, it's early days, and when you just think about the sheer mass of use cases, right, there are so many for such a broad range of modalities, anatomies, and clinical findings. I think it will take time until we have, let's say, validated, well-labeled data sets for this variety of different use cases. But definitely, what we see is that especially those imaging AI startups, they are quite often lacking access to data. And this is what our Edison Accelerator program really could help with, right? Because we bring together in this program startup companies or scale-up companies in the advanced visualization and imaging space, connect them closely to our so-called validation partners, so healthcare provider institutions. And then they not just get, like, as I mentioned earlier, access to healthcare professionals and clinical mentoring, they also get access to the data that is required to build their models. Yeah, Nicola, over to you if you have to add anything.
Yes, I think it's very critical indeed to have high quality and representative data sets. But of course, that's data that is difficult to share because, of privacy concern and protected health information. So that's not so easy to make those data sets publicly available. Although there are, I think, more and more data sets like that are open sourced for benchmarks, for AI challenges. And that's a way to yes, to compare different approaches. So yes, I think that is something that that is very useful, yes, for the development of AI solutions.
Jan, I have a quick follow-up question from the audience, and I guess you already touched upon this. Does Edison Accelerator or similar programs support startups with such data, or are startups on their own in the effort to acquire adequate training and test data?
Yeah, so yes, our programs, they can help with this, especially the GE Edison Accelerator programs, right? I earlier mentioned our Edison Developer Program, which is a program for market-ready companies, right, in the imaging space to integrate to our platform and then commercialize. The accelerator programs are more for, let's say, early stage companies, startups, or let's say a bit more mature, maybe even scale-ups who require some support and acceleration. And here there's a variety of different, let's say, offerings we provide to them, or value we provide. And one is really, as I said, access to healthcare data, but also things like access to clinical mentoring. At some point when the product has been built, when there is a MVP out there, to be able to run a pilot or proof of concept in a clinical environment. So those are things, Matthias, that we provide with this program.
Right. Thanks a lot, Jan. I was just scrolling through questions asked by the audience. I have a great one here for all of you, or mainly the clinicians probably. AI, such as radiologists, they are never 100% accurate. And the question reads, many physicians are reluctant to using AI solutions due to this limitation. How do you manage this? And please, when you answer, let's keep the focus on advanced visualization. Any thoughts on that, Kai?
Yes, well, indeed, this is one of the big issues to implement a tool and advanced tools in order that this has to be accurate. And of course, once we are going to implement one of these tools, this has to be already placed for its accuracy. And this is something that probably I have already said at the beginning, that we have to show the visibility of the results of these tools. And this is something that, of course, we are going to check at the final before our signature on the report, probably, in order to provide and to check if this analysis that has provided this tool, just to have a check. But we're going to spend less time just to have a check and to provide that this has been already the validation. But this final result, of course, is going to be more accurate with this tool that for us as a radiologist, because as I have already said, our variability in just measuring a lesion is much more variability than, of course, validation tool of AI. So for sure, more accuracy of these tools than for us as a radiologist. In this particular sense, I'm completely sure that we need these more accurate tools, of course.
Right. Orphis, Alain, how do you manage that? Any comments?
Well, just briefly, as mentioned before, we try to act upon feedback from our clinical colleagues. Specifically, we work a lot with our liver surgeons for live transplant donor programs, for example, and also for liver resection. And they give us candid feedback on what the accuracy of our volumes are when we provide post-processing volumes for hemihepatectomy, extended hematectomy, or overall liver volumes to see if there's a donor match or not. But as mentioned, an example of 16% discrepancy from what they measure in terms of liver volume to what the 3D volume calculator gives us is too much. So if you ask the patient, you want to have 100% accuracy. Everybody knows that's not achievable with humans right now, but you want to get as close to that as you can. And if you're talking about AI assisting you, at least you should have like an established accuracy level for the human, and then start from there where your level of accuracy is and how much more you can outperform the radiologist accuracy with an AI tool or whatever tool that is to assist you.
Right. Ella?
Yeah, Matthias, I think we can send our audience to the recently published paper regarding ECLAIR guidelines, which is kind of the guidelines that have been just published in European Radiology, stating what relevant parameters are to be used. Because I think what we must understand is that for each question, there's a specific metrics. Now, you mentioned, which is very important, which is the prioritization of interpreting an image. And in that sense, probably a negative predictive value of a software being able to exclude a disease is the most important criteria. And for example, for the bone X-ray that we X-ray analysis that we're using, it's above 95%. But I think what we have to make sure is that we understand that a metric that we could use to qualify a software has to be adapted to the target that we focus on, whether it's the segmentation, whether it's excluding a diagnosis, and that's very important.
Right. Earlier in the webinar, Alain, you mentioned that there is a need for exposure to AI in a residency curriculum. And this is the question. For medical students seeking to learn more about the applications of machine learning, deep learning in radiology, what resources would you suggest?
Yeah. First thing, I will just state that in the French curriculum, 1 hour of training with AI is always associated with 1 hour training for patient communication, because we do believe that both could be connected. But anyway, focusing on the AI, definitely learning to read the literature is a key feature for training and for education for residents, because they have to understand the limits of AI software, the limits of publications, the limit of a field which is very different from what we have learned in medical school. I mean, AI is informatics, it's mathematics, it's statistics, and that's a key issue. We have to train our residents to be very good in maths, statistics, and maybe informatics. But I think that's a key issue, and that's where we focus, at least in France, for the training curriculum.
Right. And speaking of training and curriculum, Jan, I would like to give you the opportunity because I know we are helping, right, to probably close this gap a little bit. Please.
Yeah, that's true, Matthias. Look, we are running together with EIT Health and other partners such as University of Debrecen, KTH, Maastricht University, and later Technology Center. We are running a educational course called Hello AI. The next one is going to be in August. And here, this is, I mean, built for, let's say, healthcare professionals, where we want to focus on, first of all, kind of demystifying the world of AI, also teaching the language behind machine learning, exploring additional medical applications, and then really making sure that healthcare professionals understand that terminology and the technology behind.
Right. Speaking of AI, I was just wondering, we haven't touched upon this, explainable AI, black box AI. I would like to ask you, all of you, do we really have to understand as clinicians how this works to the last extent, or is it just we rely on that it's a validated, you know, advanced visualization tool, and I just use it? How do you see this also for adoption, right, and increase and ease adoption, this black box explainability of AI? Any thoughts on that?
Matthias,
yeah.
Okay, I'm just unable to understand what's going on in the software. So I just admitted that I'm not good in that. But explainability is rather the explainability of how the software was trained, how the performance was evaluated, on which population it was trained. And that's, for me, the most important things to be able to explain to the patient, who could ask some questions if we rely on AI, just how the software was conceived. What's going on in it? I admit it. I'm not good at that. I just can't understand what Nicholas and others are doing. It's just too difficult for me. But just being able to say how the performance of the software was evaluated is, for me, very important.
Yeah. Looking at the other panelists, any thoughts on that?
Yeah, well, I agree also that at certain point we have to believe on this. And indeed, in most of our analysis, I'm thinking, of course, of my main field of prostate malaria, let's say. For instance, when we analyze the ADC value, when we analyze the diffusion, of course, we have to understand how is the procedure. But once we place the region of entries, we see a number there. So we believe that this number means what we have been told, that this is what should be applied. So at certain point, we also have a kind of black field that we believe in a lot of our analysis in everyday practice. So I believe this is not much very different what we should apply also in our next generation of advanced analysis of AI. So this is just to get rid of this new belief of what we are going to apply in new tools that we probably have to believe, of course. So this is my field also.
I'd like to add just that, yes, AI may be a black box for us medical professionals, but for software engineers, it's not. But the same high level of validation expectations should apply to software engineers and crafting those tools as they apply to our medical field. So yes, it may be painstaking to compare the AI performance with the gold standard that's out there. But I think it's of paramount importance to not just believe into the black box and hope that it's doing the job right, but to have it validated before it goes out to the market and hits the patient.
Right. I maybe have a final question for all of you. How does the future of radiology using AI and advanced visualization look like? Just the crystal ball here in like 5 or 10 years from now. Will there be radiologists? How does the landscape look like? Who would like to start? Short answers. Alain,
yeah,
will we still be around as radiologists?
Absolutely, absolutely. There has been a long history of innovation. I mean, radiology has been made with computers, so no need to be afraid of computers. It's just a new trend opening up, and I'm definitely very confident that there will be even more radiologists being necessary to use all that software, because preventive, predictive, and therapeutic radiology is going to be something in the move with AI.
Of course, we are all biased being radiologists ourselves, but this is a great statement. Office, what do you think?
Yes, well, this is about advanced visualization for most, and I think there it will be seamlessly integrated more and more so to a level that we won't even recognize it as such, but it will make us a lot more efficient and hopefully also accurate beyond advanced visualization, like detectability, reporting, workflow. I think will also play a much bigger role than it does right now. And again, if validated and working accurately, I think it's going to be indispensable for all of us.
Perfect. Kai, what's your final statement? You're on mute.
Yes, sorry. Yes, indeed. Of course, I don't know in 10 years, but what I'm sure is that we will be performing our main objective. That is the detection of the analysis of images in order to improve our patients. And what I am sure is that we are going to perform different of what we are doing now. I don't know, probably with these new tools that they are going to provide a different way of analysis of our everyday work that probably is going to be different of what we are performing now, because these new tools are going to change our daily practice. So this is what we should expect thanks to these new tools that we have to provide or we have to incorporate in our daily practice. Yes.
Thanks a lot, Kai. Nicola, your statement?
Yeah, I think we are at the beginning of a long journey. So we are really focusing on modernizing existing workflow, completely eliminating repetitive tasks such as contouring or going through each slice of a CT scan. I mean, that's what we do currently. There's a lot to do, but clearly in 10 years we'll do much more than that, and go in the area of better characterization of lesion, etc., better prediction, outcome prediction. That's also an area where we see currently lots of publications. So lots of things to do in the space of AI for the coming years.
Right, thanks. And Jan, you have the honor of delivering the final statement here on this.
Thank you, Matthias. Thanks. Look, I just add to what Nicola said. I think, and again, it's early days, but hopefully going forward the next couple of years, this technology, AI, will really get into radiology and helps, especially with all those mundane and repetitive tasks supporting the radiologist. And when this happens, I hope the radiologists will have some more capacity and bandwidth to focus right on the relationship to the patient, on the relationship to the referrers, and really spend time being a valuable member of multidisciplinary clinical teams.
So AI will healthcare make more human again. That is a great final statement, ladies and gentlemen. The future of healthcare using AI and advanced visualization is obviously very bright, and I think it has become clear that radiology AI systems are used by clinical radiologists during their daily practice, and therefore these AI systems and radiologists must adapt, I would say, to each other to build a co-worker relationship, I would say, which can be challenging, of course. I mean, there will be many research opportunities, to understand and build the radiologist AI system relationship, to design and to develop new technologies to really augment the radiologist's performance and to provide intelligent assistance in the radiologist workflow by, for example, automating repetitive tasks and tedious tasks and boring tasks, so the radiologist can really focus more of their time on the actual read, as well as putting together their insights into providing a narrower, a better differential diagnosis. And this brings us to the end of our session. On behalf of GE Healthcare, I would like to thank our panelists today. Thank you very much to all of you for sharing great insights on how you see the digital transformation using advanced visualization and AI moving forward. And of course, I would like to thank you, the audience, for taking the time to listen and your engagement with the panelists. And we'll hopefully see you in the field soon. Have a great day, everybody. Thank you. Bye-bye.